Interscapular pain. We see it on a daily basis, and unfortunately, sometimes it leaves our patients disappointed just as much as it leaves us disappointed when we do our best job at treating the muscles and the ligaments and the thoracic spine and the scapular stability in that area, and the pain doesn't change. Hi, this is Brandon Steele with ChiroUp, and let me introduce you to one test that's been a lifesaver in my practice. And it's a way to determine if interscapular pain, shoulder pain, arm pain is actually due to a cervical source. So a lot of us use Sperling's test to look for a cervical radiculopathy. If you remember right, standing behind the patient in this case, you're going to have the patient fully laterally flex and cause axial compression down, looking for reproduction of symptoms. While a great test, unfortunately, it only tests in one direction of motion. Choi's test is a better example of looking at the intervertebral foramen and testing it in all directions. So for this test, you're also going to create axial compression, but now I'm going to take the patient all the way through full flexion, lateral flexion, and rotate all the way down until I get to full lateral flexion and extension. When I can do this, I can actually challenge the intervertebral foramen and challenge any kind of space occupying lesion that I may see in the area and subsequent reproduction of symptoms. So if you remember from the shoulder, we can do empty can test, which is a great test for looking for any kind of issue with the supraspinatus. However, a better test is to not just focus solely on one test, that one direction, in this case 90 degrees. The dime test went in 45 degrees and tested in all arcs of motion where the patient's pushing up towards my hand, and then also at full abduction. So it's not that the dime test is a better test than the empty can test, it just tests that muscle in different directions, in different arcs of motion, looking for potential lesions. The choice test is very similar to the dime test. It's another way that we can be better at evaluating does someone have a cervical radiculopathy or not. So sometimes it's not about the best treatment, it's identifying the right test to look for the right diagnosis that can lead you into the right treatment. Thanks for listening, and check out Choi's test already in ChiroUp.